Hi, I'm Dr. Rudy Cashman. Thanks for our show. This will be very interesting and I think extremely important for you and for providers because it's not discussed very often. Nocebo Placebo. Placebo, we've all heard that term pretty much. I will heal. And if I give you something or do something and tell you this will heal you, or it can be a pill, 70% of the time it'll work. It will work. How does it work? That's what I'm going to teach you. And then nocebo. Now that's interesting. Hardly anybody's ever heard of that term. Rarely do I speak to a doctor or a provider that knows that term. It's out there. I actually wrote a book on it called Nocebo, the Evil Twin. See, placebo, I will heal. Nocebo, I will harm. Well, how are the two related? It's your perception. It's actually based on chemistry of your brain. Yes, chemistry of your brain. Candace Pert, P-R-T, wrote a great book around 1972 or so called Molecules of Emotion. Molecules of Emotion. I read that book. I rarely speak to anyone. I never spoke to anyone in the medical school, ever even heard of it. Great book. She worked at National Institute of Health and also at Georgetown. I took my neurosurgery training at Georgetown many years ago. Okay. And I recently finished 45 years in neurosurgery, as you could imagine what I did that. But in my last 35, maybe even 40 years or so of practice, I noticed that many of the symptoms, illnesses I was looking at were obscure. And then I read a book by Candace Pert in 72 after reading a book on fibromyalgia published by somebody in Columbus, Ohio, a physiatrist and orthopedic surgeon, the two of them. And then I started looking at the patients a little differently. And then comes along modern technology, CTs, MRIs. We used to inject dye in the spine, and the myelogram, I thought, were very honest. You had a defect, usually had a pain down the leg or down the arm. But CT and MRIs, although very helpful, in many cases, they've been great help, no matter where in the body. They showed the normal process of aging, but the radiologists and the ones ordering the x-rays were never taught the relationship between the x-ray findings and what they were looking at. And what they, as far as I'm concerned, and I feel I'm more right than ever, is that a lot of the things were not related to what this patient was talking about. What the patient was talking about, a manifestation of chemicals and hormones secreted in the body, also made in your white cells, that went to parts of the body, like Gershon wrote a book called The Second Brain. Yeah, about the gut. He called it the second brain because the cells in there, 40% of your immunity is in your gut, right underneath the mucosa. One cell layer where your food hits is 40% of your lymphatic system, your Army, Navy, your Air Force that defends you every day is one cell layer below the gut. But what Candace Pert showed, she's the first one to describe the morphine opiate receptor site. We have 70 trillion cells in our body, okay? Got that picture? Got it visualized? But every one of these cells have receptors, little sticky things sticking out, about 1,000 to 10,000 each, yeah. And when you take some morphine, it hits these receptors that opens the door to send the message of morphine into the cell. That's how it works. That's the first one that was described. Candace Pert is the one who developed the science of it. She should have gotten the Nobel Prize for that. But her partner at that time wanted it, kept her name off the paper. There was some argument, and Nobel Committee decided not to award the prize to either one. But that was a very significant discovery. And what she then found is that our brain, to begin with, through hormones, 50 hormones in our body, incidentally. You wonder how can we live with 50 hormones? Neurotransmitters, which jump from the axon to the dendrite. Your nerves just don't go to the brain to your toes. Periodically, neurotransmitters jump across there, maybe 35 of them. And then neuropeptides made in the brain, proteins made in the brain, also in your white cells of your body, she proved. And those three, which I mentioned, you can go to these receptors and send them a message. So how your frontal lobe is thinking, your limbic system where emotions are thinking, will cause through the hypothalamus, and then hormones in the pituitary gland send messages out to the body, also through nerves that come from there, the autonomic and the nervous system, parasympathetic, the relaxer, sympathetic, the stressor. So a combination of those three chemicals and the autonomic nervous systems send messages to the rest of your body. Yeah, it's the beginning of the proof of the mind-body connection. Then she discovers that your white cells make those same neurotransmitters, neuropeptides mainly, and they speak back to your brain. So it's mind, body, body, brain. So through your thought process, whether you're stressed or anxious or relaxed, you can affect your body. That's, in essence, mind-body illnesses. But today, hardly any provider knows anything about it. Never read the book. I rarely meet somebody who read the book of Candace Pert, for example. I wrote one after that called Welcome to Your Mind Body, based on her work and other things that were published after that. They're on Amazon. Hers is on Amazon. Mine's on Amazon. Cashman Amazon Books, it's right there. Very interesting. So a lot of the patients that I started looking at, I then realized that they had a manifestation of the mind-body connection. And when the patient had the perception on the 6-page MRI report, which may have shown just the process of aging, they coming in for a back fusion, and I would say to them, and what's going on in your life? Well, you know, my husband left 3 months ago, and I got 4 kids, and I lost my job last week. And they come in to see me with a back pain or a headache. Well, what do you think? Their doctor wanted them to have a fusion. She wants a fusion because of this report. And I knew a little more about it, and I said, well, you got fibromyalgia, and you need a massage, you need to take a walk, you need exercise, sometimes some medication, some laughter, something to reduce stress in their life, teach them about stress, for example, and they would feel a lot better without needing an injection, a narcotic, or an operation. I saw that day in and day out, because a lot of these patients were then operated on by one person or another, not me most of the time. Occasionally you'd operate one accidentally, that's for sure, because it's hard to read the human mind. And they will get better on other means. So, but now that you know a little bit about Candace Pert, a great book, Molecules of Emotion, let's kind of look at about the placebo and the nocebo. Placebo, I will heal. But you now know how the placebo works. If you believe it, it's got a 70% of work. And they've even figured out to change the size of pills, the color of pills, because you're more likely to believe it and get better. Isn't that wonderful? But they're not legal to give placebos. But you can periodically see the effect anyhow, because without any big deal, without any dangers, the patient gets better. The patient gets better. Placebos were used throughout history. Let's go in history. They've been used for 5,000 years. For example, bloodletting was a placebo. They did bloodletting all the time. Patient get better. Unfortunately, George Washington died from bloodletting. It was done for thousands of years, a couple of thousand years, and it worked a lot. Why did it work a lot? Because I feel 50 to 70% of the people go see a doctor have a physical presentation of mild stress, moderate stress, depression, mild, moderate, or severe depression, but it comes decorated in as headache, neck pain, chest pain, belly pain, numbness, tingling. This was proven to me recently. I was at a lecture maybe 3 weeks ago, and Paul Wilson, CEO at Park Center, the Psychiatric Institute on State Street, big, very experienced, nice guy. And he was mentioning that 50% of the people go see a doctor have a physical presentation of stress from mild depression, severe depression, or mild depression, and they're misdiagnosed. They're handing pills, pill to the ill, or get things done to them, unnecessary test order, a lot of cost, overreading of the x-rays by the radiologist who doesn't understand the mind-body connection at all. For one thing, they don't have the history, so they're not in a good position. But they need to have a look at this, that they read things a bit closer and to avoid unnecessary things. And this was confirmed by Paul Wilson. I jumped out of my chair because that's just what I've been speaking about. It's not taught at the medical school at all. All they have to do is read Kenneth Burt's book. Years ago, I used to go in there and talk to them about it, but they don't seem to be interested in me talking to them about it again because they don't understand it. It's not on their tests. It's medicine today is all about scientific. You know, everything is boom, boom, right there. When in reality, and Descartes cut the head off the body, 1635, gave it to the church and gave the body to science. And we've been treating medicine of the body, the heart doctor, the kidney doctor, the lung doctor. We forget that this is connected through the body, and it speaks to the body through neuropeptides, through hormones, through neurotransmitters, through the autonomic nervous system, even through splenic regular nerves. It's totally ignored, not taught at the medical school level. Major mistake. Could save billions of dollars, could save billions of dollars. Besides, they don't even treat how to get rid of diabetes in 30 days like I teach. You could save another $500 billion right there. Mistake. That's a mistake. What about the nocebo? You understand now the placebo, I will heal. I mean, they use snakes and all sorts of things. As long as you believe it, it worked. It actually worked without very little risk. And the Chinese pharmacies had 4,000 drugs in it 3,000 years ago, and they didn't change those drugs very much in 2,500 years. Same drugs, same 4,000. Changed nothing. There are a few good things in there, you know, that they, for malaria and different things, they found out they worked, but the rest was strictly placebo drugs, and they worked really well. And Mao Zedong years ago said, we no longer want to practice that way, we want to practice the Western way. Major error. He retracted that a few years later and said that was a mistake because he did not know that a good 80% of symptoms, illnesses, you want to call them, are based on perception. So he started giving Western medicine antibiotics and doing things to the Chinese people, which they didn't need. He admitted. He said it was his mistake. Then he also said a wonderful thing, though, not that he ever did say a good thing. He said it would be wise for Western medicine to adopt some Asian medicine. He was absolutely correct. I give talks on that, so understand it. So the placebo is negative speak, okay? How you present things to a patient, and they believe it. And I'll give you some examples. The same patient I spoke about, the one of the back fusion, had a scar right here, and she had gone to a cardiac surgeon because she had had chest pain here, which I think was atypical chest pain, stress chest pain. 75% of anterior chest pain is atypical, nothing to do with the heart. And no matter what they tried, it didn't work, not surprising. Then they did an angiogram, inject dye, and it showed a little bit of change in the right coronary, which at age 45 wouldn't mean a lot. It wasn't the left or anything. It wasn't a severe obstruction of anything. Because of desperation or pain, they operated on anyway, and her pain was gone for 3 months. Why was her pain gone? Placebo effect. Then it came back. She had negative blood studies, negative family history, no diabetes. You see my point? She was, in essence, noceboed. I'm sure the provider just didn't know. and doing the best to help the patient. I am sure I did it. I have an example of me doing it once. I had a patient come to see me, and I already knew the mind-body connection. It was an executive, had 35 employees. I'd seen him 3 times, had a terrible pain down his right leg. It was an awful pain, unbearable to him. And I did a mammogram, remember, which is a very honest thing, and an MRI, much more than MRIs are, and negative, nothing. Then he comes to me one Friday. He says, if you don't do something, Doc, I will have to fire my 35 employees on Monday. And he looked like he's in pain. He had an expression of pain. I said, all right. I said, on Saturday, I'm working this weekend. Why don't I operate on it, explore the nerve? Maybe there's a hidden disc there or some arthritis compressing it. I went in to operate on him, found nothing, absolutely nothing. I took a little bit of bone off to make the hole a little bit bigger where the nerve existed. The next Sunday, pain was gone, and he wanted to go home. 35 jobs, and his pain was gone. Did I really do anything? I don't think I did. And I was trying to act as a healer. You might say, you lied to him. Okay, all right. I was trying to be a healer at that point. So 35 jobs, his pain was gone. So that was the placebo effect. You starting to get the idea? Let me give you another nocebo effect. My son's a neurosurgeon. He doesn't quite think the way I do on this, and neither do other surgeons. So in my group, okay? And it takes a lot of history. I'm older, for one thing. And he says, Dad, I think I know what you're talking about now. He had a patient come in, 39 years old, female, 4 children, no husband, had a little change on, had a seizure, had a little change on MRI, looked like a malignant tumor. You can't be 100% certain, but it looked like glioblastoma. So she asked how long I have to live and all that, and this is him talking to her and say, well, normally you have 6 months to live, and gave her no hope. Not that, you can show a person's statistics, but that doesn't mean they're the statistic, okay? And you can say, 10% chance we can get you through this. I'm going to do everything I can to help you. Give her a hug. We're going to try chemo. I'm going to send you out of town for some research drug or something of that nature. And by golly, do the best we can. And how you think is important. So I want you to see if you can keep yourself together, reduce stress if possible. But how you reduce stress? You got 4 kids, you got no husband, and the whole situation would. You know what happened? She starts screaming. Right there when he's sitting there, she screamed all night. Then he operated the next day, did a biopsy, confirmed it. Goes back in the room, tells the same story. She screamed all night and was dead the next day. Little tumor like that. Was dead the next day. What happened was, it's like the voodoo effect. You remember in ancient times, if the witch doctor pointed his finger at you, the person that pointed at in the tribe usually died. What it is, and that's been scientifically proven. A guy in Boston, a neurologist, did a study on that, gathered the literature on that. It's actually true. And it is because the neurotransmitters attack the heart, called pulmonary hypertension and arrhythmia. And this is a real physical death because of the patient's, she was noceboed. Didn't mean to do it, but it happened. But when you look back in history, you'll speak to very few providers know this history. I know this history. And matter of fact, I saw a famous neurologist from Harvard present at a meeting in Boston, 3,000 neurosurgeons from all over the world there. And he's giving a talk on this for a half hour on the voodoo effect essence. He didn't call it the nocebo, called it the voodoo effect, the pulmonary hypertension that's developed due to actual neurotransmitters. So when he got off the stand, I went up to him and I said, I'm writing. That's when I was writing the book on the nocebo, the evil twin, and unfortunately, he said to me, I'm on vacation this week, send me an email. What I had wanted him to do is to talk to the surgeons about the nocebo effect of overreading MRI scans, because I'm convinced a lot of the fusions, things they do, they're needed in some people, they definitely are needed in some people. But definitely some people don't need it because they overread x-rays, apply a nocebo to the patient. They believe they need it and they get it done. Surgeons many times have no idea what I'm talking about, so they're being honest about it, but they don't understand it. It's you know, it's a procedure to the ill instead of talking to the patient. I saw a lot of that in my years of neurosurgery. That's the reason I started writing about it. Do you understand the nocebo? It can be a blood test, can be a nocebo. It can be an X-ray test. You can be nocebo by the provider. I've had a patient come in to see me before I stopped neurosurgery. I remember, nervous-looking guy, and he'd had a neck pain, headaches. I think it's fibromyalgia. I took the history. Very stressed individual. But it did an MRI of his neck, and it showed 3 dried-out discs, which is not uncommon when you're age 60 or so. That's common. That's normal for the age, okay? And the surgeon told him that if he didn't have those 3 vertebrae removed, 3 discs removed and fused, he would die or become quadriplegic, paralyzed arms and legs, and he was really frightful. I don't blame him. So I took a detailed history and find out that MRI thing had nothing to do with him. It was a case of advanced fibromyalgia, where the hormones, neurotransmitters, neuropeptides were affecting the cells in his body, all over his body. He had belly pain too, and did not need that surgery. Is this important, the teaching of the nocebo to medical schools? Yeah. How a lot of things in medicine, always more fancy stuff, always more fancy stuff. When half the people, Paul Wilson, remember, Park Center, psychiatric, CEO over there, they go see a provider, have mild or moderate or severe depression, but they don't come in like that. They come in decorated, headache, neck pain, can't sleep, bellyache, skin rashes, atypical chest pain. In this book that I wrote, I put in there the mind-body index, and that is kind of interesting. In other words, what the mind can do to the body. And if we go back in history a little bit, you'll see years ago with Freud, you know, stress, we called the symptoms hysteria. Then it was called myasthenia. Yeah, a gentleman, a doctor, PhD named Snyder at IE Purdue wrote one of the best books I ever read on myasthenia. But 1850, 1920, these kind of symptoms were called myasthenia. They used to put them in hospitals in Kalamazoo and Grand Rapids and lock them in there for a year or two, especially women. It's called myasthenia. And then that kind of went up, but they realized that wasn't the right thing to do. So then they called it psychosomatic disease, and someone wrote a book, Alexander wrote a book in 1954, and he has an index in there where he considers mind-body illnesses, just like in my book. And at the end, it's interesting, he puts tattooing. That kind of woke me up because doing back surgery, you constantly see the patient's whole body. And you could see a lot of times if they had, not everybody, of course, and some tattoos are just fine. But you could see some patients had the whole body decorated, and invariably, many times, they were narcotics. Many times. I warned my partners about it, and they began to wake up to it. So tattooing can be mind-body disease. They have this done to relieve stress because they sticking a needle in there secretes endorphins, a morphine, your own morphine. Okay, remember Candace Pert and the opiate receptor. Okay, we make our own narcotic, except if the body makes it, it's not addictive. Okay, and it is sort of that's very interesting. This mind-body connection, and I can think of another patient. I saw this patient in Van Wert Clinic, came to see me, and she was going to have an operation the next day by a surgeon, detailed history, like 6 kids, no husband, rashes all over the body. That's right, and she had big bumps on these knuckles, and nobody could figure it out. But finally, I figured it out, and I saw her years later. And the reason she had these big bumps here, no, it was worn down to bone. Very unusual case. And I finally figured out, All that stress, you know what she was doing? She was going like this. I finally figured out. I saw her years later. I treated her years later. She came, and she was dressed in black the first time I see her. I never forget her. She came to see me. She had on a red outfit and yellow pants, lipstick on, and everything had cleared up. I was quite right. A most amazing case. So what I'm saying here in summary is that how we think through neurotransmitters, hormones, and neuropeptides affects our 70 trillion cells, and our white cells make them too. So when you go see a provider, you need to go see a loving provider, that they take detailed history. If it's just ill to the pill, if it's surgery to the report, get some other opinions, look around, and that's not easy to do. The mind-body connection is totally missed by the med school. They still don't get it. They could save a fortune, but it is confirmed by Paul Wilson, CEO at Park Center. And if you combine that with diabetes prevention, we can save $1 trillion. But I wrote a book called Placebo, Nocebo the Evil Trill on Amazon. You might like to read it. Only 50 pages, but it might save you a lot of trouble. Thanks for watching. Watch our other shows, TV shows, read our books. And the reason we do this, because we love you. That's why. Make you healthy. Mayor Henry calls me Dr. Wellness. He's done it 9 times, and I highly appreciate it. He understands. He understands. And namaste. Hope you have a great day. Take a walk. Sing a song like I do, like I did this morning. You'll feel better. Bye-bye.